Pyometra will consider about the etiology, symptoms, diagnosis, treatment for today. Pyometra is just simply the accumulation of pus or purulent material in the uterus. In the dogs and cats, we call it pyometra. In the larger animals, we normally call it septic endometritis. But pyometra is a better term for the dogs and cats. Differential diagnoses are hydrometra, mucometra, hematometra, pyovagina, even pregnancy also is a differential diagnosis for the pyometra. Now, how does it develop? Of course, it is a life-threatening disease, pyometra. If we don't, treat it on the right time, then there will be toxemia developing and the animal can die. Now what happens is, as you know, in the larger animals, such as in the cattle, the Easter cycle, it is of 21 days normally, and then the corpus luteum regresses, and the new Easter cycle starts. But in the dogs, the diaestrus period or the gestation period, that is about 65 days or 63 days, whether the dog or cat is pregnant or not pregnant, the corpus luteum will stay for the full diaestrus period or full gestation period, right? That is, the animal is mated, whether it conceives or it does not conceive, the corpus luteum will stay there for the full gestation period. So what happens is, corpus luteum will secrete progesterone. Progesterone, what is the effect of progesterone? It will repair the uterus. There will be, hyperplasia of the endometrium. Sometimes there are, cystic hyperplasia of the endometrium. If, you don't mate the dog or the cat for continuous 3 or 4 Easter cycles, so this disease can develop due to hyperplasia of the endometrium system, and then what happens is the bacteria will attack and the sepsis starts. So pyometra takes place. So it is always then better that if the owner asks you what to do, we don't want any pups from so don't try to suppress it with the hormones. Sometimes we use the Camilla or progestins, etc., to avoid the pregnancy. But it is always better at least in the dogs and cats, to do the ovariohysterectomy. So you should advise the owner that ovariohysterectomy is a better option as compared to the use of drugs if you don't want any pups or any kittens or any offsprings from these animals. Okay. So the progesterone stimulation, glandular tissue becomes cystic, edematous, thickened, infiltrated by lymphocytes, plasma cells, and then the infection takes place. It may be due to, from the urine infection can go, from the vagina infection can go inside. Mostly they are the E. coli, Staphylococcus aureus, etc. These are all the organisms which are attacking the uterus. So actually now, because the progesterone, it inhibits the contractility of the uterine walls or uterine muscles. So the fluid, it will stay there because the uterus is not contracted under the influence of the progesterone. So the fluid which is accumulated, it will not come out. So it remains there, and the infection takes place. So this is the abnormal uterine environment which allows the bacterial colonization and consequently the pyometra. Similarly, sometimes if you give estrogen during the diaestrus period to prevent or to terminate pregnancy, it will also lead to cystic hyperplasia, because the estrogen, under the effect of the estrogen, the progesterone receptors of the uterus, they are increased. So when the progesterone receptors are increased in the uterine wall, then there will be hyperplasia of the uterus. Endometrial hyperplasia will take place. It will increase the number of the uterine progesterone receptors. So that's why we always say that don't try to use the hormones for these purposes. It is always better to go for ovariohysterectomy or to advise the owner for ovariohysterectomy. So there are basically two types of the pyometra. One is open pyometra, other is closed pyometra. Open pyometra is that in which the cervix is still open and some of the material it keeps on exuding, it keeps on coming out, and the animal is not that sick. Whereas in the closed pyometra, the cervix is closed, all the pussy material, pural material, it remains in the uterus, in the horns of the uterus. The animal gets toxemic and it is a real sick animal with the closed pyometra. Real sick means it will be depressed, dull, off feed, distended abdomen, etc., all those things. Normally, this is a disease of the old age, but in young animals also it can occur, particularly in the nulliparous bitches. Nulliparous bitches are those which have never been bred. I have told you before also that if you miss 4 or 5 estrus cycles without mating, this disease will be there because with continuous exposure to the progesterone, the endometrial hyperplasia takes place, cystic hyperplasia will take place, and the fluids from the cyst that will accumulate in the uterine body and the uterine horns. Could land sometimes bloody vaginal discharge. Normally, the history will be that the dog or the cat was in heat about 4 to 6 weeks before. We did not mate the animal, and this has been this has been the practice for the last 3 or 4 estrus cycles. We are not mating the animal, so after the last heat, 4 or 6 weeks after the last heat, the animal will come to you with that complaint that now it is depressed, it is distended abdomen, it is taking too much water, it is urinating too much, polyuria, polydipsia, etc. So this is the normal history now. So when this is the history that the animal is not being mated for 3 or 4 consecutive estrus, so the number one disease on the list should be the pyometra. There will be abdominal distension, fever, anorexia, lethargy, polyuria, and polydipsia. Because the bacterial toxins or bacterial endotoxins, they inhibit the action of the ADH. They inhibit antidiuretic hormone. So when the antidiuretic hormone is inhibited by the bacterial toxins, what will happen? There will be more production of the urine. There will be polyuria. Now, when there is polyuria, the animal will get dehydrated. So the animal will take more water. So that's why the animals suffering from this condition, they will have polyuria and polydipsia. This will be the main history also, that the owner will say that the animal is depressed, distended abdomen, but it is taking too much water and it is also urinating too much. So polyuria, polydipsia due to inhibition of the ADH by the bacterial endotoxins. And vomiting, diarrhea, these signs will be more pronounced in closed pyometra. In open pyometra, these signs may not be very pronounced, but in closed pyometra, very pronounced signs. So diarrhea, vomiting, in closed pyometra, dehydration, endotoxemia, septicemia, hypothermia, all those conditions, because due to what happens in toxemia, those all conditions will be there. This is a closed pyometra case, distended abdomen, and you can see, the external genitalia, there is nothing there, okay. But if you feel it, you will feel the distended abdomen. However, here, one advice is that don't press it very hard. When you are palpating the dog or the cat suspected for closed pyometra, don't press it so hard because the uterine wall has become very weak. So if you are very hard pressing the abdominal cavity, the uterus may rupture. The uterine horns may rupture, and then you lose the game. When it ruptures, the whole of the pus or purulent material will go into the abdominal cavity, and then it is of course very dangerous for the animal. So this is a good example of how all the external genitalia is very clear. The distended abdomen. You will also see that the mammary tissues, they are also enlarged because under the progesterone. This is the open pyometra. You can see this pussy material coming out from the external genitalia. So in this case, the animal, the abdomen will not be too much distended. Okay? And the animal will also not be very sick animal because all the pus material is coming out. But if you just think that if the whole of the pus remains inside, what will happen to the animal? These are some of the photos for the closed pyometra. Now for this pyometra uterus. Okay. This is also, there are so many pictures you can see on the net also, and I also have many pictures about that. Okay, these are all the and this is now here what I was saying is that if this is the condition of the uterine horse, and if you press it very hard from the outside, what will happen? It may easily rupture. Sometimes we normally say that it's a paper thin uterus when the animal is suffering from pyometra. Paper thin uterus means that the walls of the uterus are very weak, just like the paper, which will tear away very easily. Clear? So this is how we just call it. Of course, it is not like a paper, but this is an example that it is so thin, so weak that it will rupture very easily if you do hard pressing of the abdominal cavity. Okay. This is also mucometra, etc. All these things. As far as diagnosis is concerned, again the radiographs, ultrasounds, fluid-filled uterus, you can see on the radiographs, and also you can see it on the ultrasounds. On the radiograph, you will see the fluid density. On the ultrasound, you will also see that echoes coming back. So it is important to rule out pregnancy also. As I told you before, that the calcification of the skeletal system does not occur before 45 days or 40 days. So before that, radiographs may not help you, but the ultrasound will help you. So in open pyometra, radiographs may not be very fruitful because in open pyometra the pus is coming out, so you may not be able to see the shadows of the pus or the fluid filled or pus filled uterus. You may not be able to see it. But in closed pyometra you can, such as this one. It's a case of closed pyometra. You can see this. This is the pus-filled uterus. But if it is an open pyometra, may not be there. Similarly, over here, you can see these are all those. These are all the they are pus. Sometimes you can call it pus puppies, right? So they are just like the pus-filled uterus. They are you see, this is the one uterine horn, the other uterine horn, this is the urinary bladder over here. So you will see all this. This is very clear. The one horn of the uterus, the other horn of the uterus, and the urinary bladder. But both will give the black shadow because they are both the fluid. Maybe it is a pus or it is the water. They will give the same shadow. Similarly, over here it's a very clear diagram. Over the bladder, one uterine horn, the other uterine horn. So on ultrasound actually is far better in such cases as compared to the radiography. In the lab test, the infection is going on in the uterus. So what will be the reaction of the bone marrow? There will be more leukocytosis. More leukocytes will come out. There may also be seen the left shift. Left shift means immature leukocytes will also come out when it is a very pronounced case and the normal leukocytes are unable to combat the condition. Sometimes immature leukocytes will come out. However, there is one species the equine species which never send immature leukocytes in the blood. There is never left shift in the equine, remember it. But in all the other animals, left shift can occur. Okay. So there may be more than 30,000 per microliter, maybe as high as 1,000 to 300,000 per microliter. They may be often normal in open pyometra. Because in open pyometra, the pus is coming out, so the body has not to react too much, right? So, but when it is open pyometra, it is very obvious that it is pyometra. But in closed pyometra, the leukocytes will be very high. Leukopenia, then in the last stages, anemia, clotting abnormalities, DICs in severely affected patients. There may also be pre-renal azotemia due to decreased renal perfusion. There will be increased urea, increased creatinine in the blood, okay, in the serum. So as far as treatment is concerned, we have two types, the medical management and the surgical management. However, for all the practical purposes, it is a surgical disease. However, you can use certain medicines such as prostaglandins in very valuable pedigreed animals, or if the owner says that I don't want to lose the reproductive ability of this animal, that is, he doesn't want to go for ovariohysterectomy, we can try. However, this is not it may be successful only in some percentage of cases. But recurrence rate is again there. Recurrence can, because even with the medical management, you cannot remove all the pus cells from the uterus. So if only some pus cells remain there, they will again grow. Bacteria will again infect. Okay. So prostaglandins, they can be used, but with limitations, because prostaglandins are not harmless drugs. They are, they have too much side effects, such as rupture of the uterus is one of the good side effects of the prostaglandins, because it will cause contractility. So if you are using it in a closed pyometra case, of course it will open the cervix also, but it will cause too much contractions of the uterus, so the uterus can rupture it. So this is one of the very bad side effects of the use of prostaglandins. So how do they work? They will lower the blood level of the progesterone, relax and open the cervix, and cause uterus to contract, expelling the bacteria. These are the basic things on which we use the prostaglandins, that what they will do, how do they work it. Commonly used drugs, they are PGF28 and Lutalized. It is available in the market, 0.1 to 0.25 milligrams per kg subcut for about 3 days, 5 days, right? Or you can also use 0.15 milligram per kg intravaginally. Then you raise the hindquarters so that it flows down through the cervix into the uterine body and the uterine horn, and it will have a local effect. You can also use antibiotics with the prostaglandins in metabolically active dogs or very valuable breeding animals. More than one series may be necessary. That is, you just give one series, the animal is okay. Then again, sometimes there is effect of the, because you cannot empty whole of the uterus, with the treatments actually. So the rate of recurrence is about 75% in such cases. And you treat the animal, again, it will develop in about 75% of the cases. The owners must be told beforehand about the side effects of the prostaglandins. Otherwise, the owners will blame you. If something happens to the dog, then the owners have all the rights to blame you. So you have to tell the owner beforehand, that is, what are the side effects of the prostaglandins. That is, serious complications, example, uterine rupture is one of the very good complications. Leakage of the intraluminal contents into the abdomen and sepsis, they are possible. Then, short-term complications or short-term side effects They include panting, salivation, emesis, vocalization. They last about for about 1 hour, 1.5 hour, 2 hours. They are short-term complications. Or defecation, tenesmus, urination, nesting, mydriasis, and lordosis in intensive grooming. Lordosis is backward curvature of the spinal column. That is the lordosis. It is opposite to the kyphosis, which is outward in vagination of the spinal column. So these are the short-term side effects. High doses of prostaglandins, they may cause ataxia, collapse, hypovolemic shock, respiratory distress, and death. So all these side effects have to be told to the owner beforehand when you are using prostaglandin treatment. This just I have told you just now that success rate for the treating of open cervix pyometra is approximately 75 to 90% in uncomplicated cases. However, the recurrence rate is also 75%. Now, the success rate for treating closed cervix pyometra is only about 25 to 40%. The rate of recurrence is again 50 to 75%, and chance of future successful breeding is decreased to about 50 to 75%. That is, it will also not be good for further breeding. That is, conception rate will come down up to 75%. The surgical treatment is the ovariohysterectomy, of course. So that is actually, as I told you before also, by all the means, it is a surgical disease. However, we can try prostaglandins, antibiotics, etc., or draining of the uterus or removal of the corpus luteum sometimes to decrease the source of the progesterone. But they are all negative, positive, sense. Okay. So the chance of successful resolution without surgery or prostaglandin treatment is extremely low. So therefore, OVH should not be delayed more than what is necessary. That is, don't, if you decide to do the ovariohysterectomy, don't delay it. Now here, the ovariohysterectomy procedure is the same. The only thing is that you have to really be very, very careful because the uterus is very fragile. You just, when you take out the uterus, exteriorize the uterus from abdominal cavity, so you should be doing it very, very politely so that it does not rupture. And secondly, when the animal is lying on the dorsal recumbency during surgery, there is a pressure over the aorta and the caudal vena cava by the gravid uterus or by the pyometra uterus. So when we want to exteriorize it, the pyometra uterus, suddenly the pressure will be released from the aorta and the animal may go under hypotension. So when you want to exteriorize the pyometra uterus, always increase the drip rate beforehand so that the animal does not go under hypotension. So this is one of the precautions where you are exteriorizing this uterus. So sometimes what happens is, the other thing is, beware of the stump pyometra. Now when we remove the uterus, we remove it exactly cranial to the cervix, even in the normal ovariohysterectomy. So if only a small part of your uterus is left cranial to the cervix, which is infected, it again becomes an abscess there, which we call as stump pyometra, or stump in the abscess of the uterus. Now, abscess in the stump of the uterus. So in such situations, what we normally do is, we always remove whole of the uterus. We don't leave even 1 centimeter of the uterus inside. Just cranial to the cervix, you have to remove whole of the reproductive tract. Otherwise, stump pyometra will be there. If it is there, stump pyometra, the signs will again be the same. Leukocytosis, the animal will also become, there will be maybe discharge also from the external genitalia. This was a cat which came over here, is the urinary bladder. No, we just checked it. The history was that it was spayed by some private practitioner in Lahore, and after spaying, the animal was also coming into heat, and also there was discharge from the external genitalia of the pus. They used antibiotics. With the antibiotics, the condition was suppressed, but when they leave the antibiotics, again the condition will come back. So we checked it, and on the basis of the history, if the history is that the animal is coming into estrus even after ovariohysterectomy, it means some part of the ovary is left there. And if the pus is coming out from the vagina, from the external genitalia, it means there is the infection of the stump of the uterus is there, stump pyometra. So this is what we did. So on this picture, you can see this is the uterine bladder over here, and this is that stump of the uterus which was filled with abscess, filled with pus. These are all, here was the cervix over here, and this is all the uterus, the remnant of the uterus which was left there, and it developed into an abscess. This is very clear again. You see, this is bladder over here, and this is the stump that. So after remove it, we just remove it from here, just cranial to the cervix, and the animal was okay. And then after that, what we did after removing this one, this was the uterus, remnant of the uterus which was left inside. Then we went forward, checked for the ovaries. On one side, the ovary was there. So then we also removed that ovary. This is the ovary over here, and this is the ovarian pedicle, right? So we just removed the ovary also along with the pedicle, and the animal was happy after that. So the condition resolved. So this is what happens, when you don't do the surgery carefully. So as far as the Pyometra cases are concerned, be sure that you are removing all of the reproductive tract cranial to the cervix. Only cervix should be left inside. In a normal animal, sometimes maybe that some uterus, part of the uterus remains inside, no problem. But in Pyometra cases, whole of the reproductive tract should be removed cranial to the cervix. Okay. But this way, the ovary, this was an added problem, right? Because the spaying was not done properly also. This is again on one side, this is the ovary. You can see on the other side it is the stump of the uterus. So sometimes they also do it, you can remove the corpus luteum, in certain situations for drainage, to do the drainage of the uterus without OVH. That is, it is drained and corpus luteum is removed so that progesterone source is removed. So this also sometimes happens. But in post-operative care, antibiotics and fluids, they are very necessary. Because it was a septic case actually, it was a Pyometra. So antibiotics and IV fluids are very necessary. Otherwise the animal will go downhill. So now here one thing I want to tell you is that now just after ovariohysterectomy in a Pyometra case, you will see on the next day the leukocytosis is even more. Now we wonder that we have done the surgery, we have done everything, why there is now leukocytosis? Can you guess? Infection is there, but the thing is that the body does not realize at the same time spontaneously that the uterus has been removed. So you remove the pus-filled uterus, but the bone marrow is still active. It takes time for the bone marrow to react to this condition, to recognize that there is no more need of the leukocytes. So it keeps on releasing the leukocytes for the time being. And on the second day, third day, you will see more leukocytosis. But that is normal. After that, when the bone marrow realizes that the pus-filled uterus has been removed, then the leukocytes will come down. Clear? Yeah. Okay.